Oral appliances are the first-line treatment for CPAP intolerant, those that can't or won't use CPAP. We can treat people with primary snoring, those that do not have sleep apnea, they only snore. And we also are for people that had a sleep study, had a negative outcome, and yet they have all the signs and symptoms of sleep apnea. We can treat all those groups. Let's begin with what is normal. People ask me if snoring is normal. The answer is no. Snoring is common. The American Academy of Sleep Medicine estimated that 90 million people snore in the USA. Of those 90 million people, about 50 million have some level of sleep apnea. We're only diagnosing about 10% of those. You can have snoring without sleep apnea, called primary snoring, but it can also be a sign of sleep apnea. What actually is normal? Quiet. A linear airflow is actually quiet. So when we sleep, it should be quiet. When there is a disturbance in the airflow pattern, it causes tissue vibration, and that's the snoring that we hear. People that snore loudly may have a range of over 100 decibels. We're speaking at about 45 to 50 decibels right now. That 100 decibel range is equivalent to sleeping next to a jackhammer or an airport. This can cause hearing loss for your partner as well. So, are you here for sleep apnea? Maybe? What is sleep apnea? What is sleep apnea? By definition, it is a 90% reduction in airflow. It has to last a minimum of 10 seconds. Basically, you stop breathing. A good analogy to remember this. Have you ever had a sundae or a thick shake drinking through one of those fat straws and enjoying it? Then the straw gets jammed into the ice cream. Suddenly, it just collapses. The harder you suck, the more it collapses. This is in a nutshell is an apnea. This is your diaphragm trying to pull oxygen down to your lungs, but the airway has collapsed, like the straw. The more the diaphragm works, the more the airway collapses. We will talk more about how we save ourselves and how we get out of the apnea a little later. The second definition I want to provide is a hypopnea. A hypopnea is a 70% reduction in airflow, also lasting a minimum of 10 seconds. And the scoring is also done by blood oxygen desaturation. It can be 3 or 4% depending on what they're looking for. There is a score you will hear about called AHI. This is the apnea-hypopnea index, and it is no more than the number of times that you either have an apnea or a hypopnea in a sleep test. They divide that by the total time you slept, if it's a lab test, or the time that you turn the machine on or off, if it's a home test. Those are the two types of tests that can be used. The AHI is used by doctors so that we can speak to one another. It defines if you have sleep apnea or not. It also gives the level of severity so the doctor can decide how best to treat you. By definition, the average of less than 5 events per hour means you're normal. A mild case is defined as between 5 and 15 events. A moderate case is 15 to 30, and a severe case is someone that has over 30 events per hour. And I've seen well over 100 per hour in some patients. What this doesn't tell you is it doesn't describe oxygen desaturation. It doesn't talk about cardiovascular health. It doesn't tell you how symptomatic you are. I find that people on the lower end of the scale are more symptomatic than those on the severe end. It is merely a way to define the disease and how to treat it.